good news. To complicate matters, a recent study published in the Lancet Diabetes and Endocrinology seems to suggest that vitamin D has no benefit or positive effect on bone density. Vitamin D helped none of the 32 women in the trial to reduce their MI, stroke, cancer or hip fracture. The study-led author Dr. Mark Boland from the University of Auckland in New Zealand said that there is little justification currently for prescribing vitamin D to prevent heart attack, stroke, cancer, fracture or otherwise in healthy people. A study of just 32 women is considered rather small, don't you think? Did this actually display anything? Well, the test was only done on 32 people, so again, think about this. On the other end of the spectrum, Dr. Cedric Garland, the University of California, San Diego, says colon cancer cases could be cut in half if people took just 2,000 IU of vitamin D daily, and breast cancer cases could also be cut in half if women took 3,000 IU of vitamin D daily. Dr. Garland is a long-time enthusiast of vitamin D. Personally, I take 30,000 IU of vitamin D daily, and I still have lower vitamin D levels than the therapeutic target range. I had started to take 50,000 IU daily for a 2-week period prior to reducing the dose to 30,000 IU. So who is right? Vitamin D protects you from getting colds and flus, it strengthens your bones and muscles, and it lowers the risk of cancer. So why do few researchers still insist vitamin D does not reduce the risk of heart attack, stroke, cancer or bone fractures? Well, there's 2 reasons. Some poorly informed doctors still prescribe vitamin D2. Now this is very important. D2 is harder for your body to absorb and less effective than vitamin D3. Vitamin D3 is what you get from the sun, not vitamin D2. Take note, folks. Most researchers use 400 to 800 IU a day in their studies, but this amount is just too small to be effective, and it's not clinically relevant. A study published in the American Journal of Clinical Nutrition in 2007 used higher dose amounts of vitamin D with great success. So this goes to show a higher dose you'll see the success rate. The lower dose just simply is not enough. During the 4-year study, women who take 1,000 IU of vitamin D and 1,450 IU of calcium daily were 77% less likely to be diagnosed with cancer. Go figure, 77% people, what is that telling you? When doctors gave Japanese school children 1,200 IU of vitamin D3 daily, the children were 42% less likely to get the flu and 83% less likely to suffer from asthma attacks than those who received the placebo pills. So go figure, use common sense here, people, again. As I've previously stated, we are all individuals, and as such, we absorb vitamin D differently. What matters is how much vitamin D we have at our disposal, not how much we actually take. As I said, a simple blood test will reveal your disposable vitamin D, and this is how to calculate how much your body actually needs. So how to boost your vitamin D? First and foremost, we look at naturally. And the natural source of vitamin D3 is in the sun. So, sitting in the sun for just 20 minutes during the summer in a bathing suit without sunscreen will give you the best quality vitamin D. And from what I learn, there is no danger of toxicity from vitamin D your own body makes when exposed to the sunlight. But you may not have much choice but to take oral supplementation in the winter months. depending on the climate of your chosen country of residence. Make sure you choose vitamin D3. Do not get this confused with vitamin D2. Vitamin D2 is what's used in fortifying milk and some other foods. Also, make sure you take vitamin K2 always with vitamin D to keep calcium from building up in your arteries and soft tissue. Whilst the dose is argued, you can simply continue getting out healthier. Some people believe the vitamin D controversy will end once and for all when a current large-scale study called VITAL releases its findings in 2017. Given the medical establishment's knack of manipulation such studies, I'm not very confident. I'll certainly review those findings when they come, but there's little doubt in my mind that vitamin D3 plays a huge role in boosting your body's immune system and the ability to fight cancer and other disease naturally. And the importance of clean vitamin D. It's proving increasingly impossible to find a pure source of vitamins and minerals nowadays. Vitamin D3 is no exception. I was trawling through the internet researching where to purchase a clean, pure vitamin D. To my horror, over 90% of vitamin D3 now contains magnesium stearate. Magnesium stearate actually blocks the stomach's absorption of any vitamin or mineral. I've written the full skinny on this and I'm going to provide the link. Vitamin D3, all as you actually need is the vitamin D and olive oil, cold pressed organic to suspend it in. It's very, very simple, people, but they seem to want to block the vitamin D. Why is this? Why would they want to stop us taking vitamin D? Let's think about it. Vitamin D, like I said, can stop illness. It's preventative as well as a cure. So what we have to think about is how much vitamin D, let's conclude, how much vitamin D our bodies actually need. Well, that depends on the individual. As I said, do take the test. It's no point keep popping the pills if you don't know what your vitamin D level is. Thank you for listening, and I hope we're all more educated with vitamin D. Thank you.
Thank you, Mary. And don't forget about our upcoming seminar on taking control of your health in Orlando, Florida on February 13th. Details will be provided in the description below. Thanks for watching, and this has been Healing Oracle.